I will again go to the next session, closing remarks and next steps. I think we have already touched some of them, but doesn't matter. I will invite our beloved partner who has been responsible for the great success of the show, Dr. Dieter Schillinger, DDG Biosciences, International Livestock Research Institute. Sir, over to you.
Actually, there's not much to say from my side. I just would like to thank the co-organizers with ILRI and the way how we went through the difficult times where we were not quite clear how we manage everything. But particularly, I would like to say thank you to, I think it's Abhijit from your side, from APAR, and Ekta Patel. The two were really doing the very important work, keeping things together, updating and communicating. And really, that was a fantastic cooperation. And I would like to thank the two particular, as well as you, Dr. Rao, and Kay van der Horst as well. So this is the time to say thank you, but not adding new information and ideas. Thank you very much.
Thank you. So I'll move on to Dr. Kai. So your remarks.
Yeah, I was thinking about some closing remarks, but then I thought about all the richness that was covered by the panel here, where I think there's really not that much to add. And I think just bringing some things back as a principle at a very high level, I think we need to really build on the discussions we've had that aside from financial sustainability and building that globally, we really need to look at enabling mechanisms which allow us to build out the One Health security space. Facilitate open and equitable data sharing without incurring the risk of punitive actions is essential. We must overcome disincentivizing. I just gave an example. Countries should really not have to worry about having entire industries get wiped out if they share data openly. We need to think about a global system of rewarding and advancing collaboration of data sharing, because this will be vital to actually prevent future outbreaks. I talked about the novel technologies just before, but then also, what hasn't really come up in this discussion, which I hope we would see more in, is what we've seen during COVID is that the financial mechanisms were not in place to really secure the logistic trails that enable effective One Health surveillance. So it is about access to consumables, to reagents, while reducing costs. I mean, the cost disparities of transport and sequencing range from $18 per sequence to $230. And it has something to do with procurement and supply chains and inconsistency in forecasting. So there's really an immense potential to catalyze One Health security ecosystem stakeholders into, and we saw that today and yesterday, into essential, meaningful collaborative dialogues that can truly anchor and advance trust within the integrated ecosystem, as well as define principles and attributes to achieve the change we are seeking. So yeah, I mean, I think I'm echoing what you're all saying. We have really unique opportunity in time and history to make a transformative impact on global health. You are the people that will help us not to squander that moment. And I look forward to collaborating with you in the future. And thank you to all the panelists, to the ILRI team in particular, for providing immense kind of heavy lifting to make this work and make this a success. Thank you so much for that.
Yeah, thanks, Dr. Kai. In fact, your voice is my voice. So therefore, we had our voice. So one important thing I would like to add is that it is a time to thank people. One of the important things is I should thank Dr. Dieter again and his team. I do agree with him that Ekta from your side and Dr. Abhijit from our side have been working on the background, and I thank immensely both of them. And there were also two more players here for the last 3 days helping me to come to the to make an effective Zoom session. I think it is Praveen and also Ram. These are IT people. I should also thank them. I don't know whether you can see them. So come here, Ram. These people have been helping us in many of the Zoom meetings, particularly with the APAR. I think they deserve appreciation. Thank you, Ram. Thank you, Praveen. Yeah. And more important is that Bernard and many other people in the team, for example, at the ILRI head office, and bunch of people actually were helping to scout the speakers and then tell names after names. Even in the last moment, particularly 2 sessions, access to innovations and also vaccines. And a lot of help has been rendered by various corners. We also thank all the other participants than the speakers and the moderators who have been patiently listening to us and also asking for some questions. I think thanks for your participation here. We will share with you a lot of information on our website. And we also thank all the, eminent, authorities from OIE, WHO, and also our Indian government and many other policymakers yesterday. I think they made us a beginning to opening remarks. These opening remarks have been driving force, particularly Jimmy from ILRI. I think he participated twice in 2 panels, a lot of rich contributions. And Vivek has been very, important in scintillating discussions, followed by Suresh. So we had every session has been richly deserving a lot of applaud. It was a great celebration. For my part, it is a celebration I call, celebration of One Health. And we have achieved certain goals, so still something remains. Otherwise, we can't have APAR going forever. So there are many issues to be covered. And when I look back at 2019 session with 200 people physically, there was no Zoom or nothing. There was huge panel discussions on diseases, and then revisit the declaration we had. Yes, I agree with our earlier version of discussion within our own group in APAR that we have to revisit and maybe change the declaration a little bit. Probably we'll come out with some sort of a declaration of this particular conference. That may be one step, and also documentation. APAR website will also carry certain of the glimpses of these videos which have been covered. I think at this point, I thank you all. And if I missed anybody, please pardon me. And it was a great day, great 2 days session. Thank you very much.
Thank you.
Thank you. Thank you, Dr. Rao.
And most important is I missed one. I remember now that our Agari Ambali and Barbara, these 2 people from Australian Union, although there were some gaps, but otherwise, my apologies for missing them. It was a great contribution from African Union. And because of their participation, there was a holistic representation of many of the aspects that cover many parts of the Africa. I think Dr. Kai has something to say before I stop. So it's fine. Thank you very much once again. Thank you, everyone.